Reporting that this first confirmed case of COVID-19 is the patient is allegedly in KwaZulu-Natal. Let's now talk to SABC News reporter in that province, Simphiwe Makhanya, who's in Pietermaritzburg. Simphiwe, a very good afternoon to you. Thank you so much for coming through. Now, not much is really being said. We only understand that it's a 38-year-old man who's just traveled back from Italy, who is in KwaZulu-Natal. What more information do you have?
Afternoon to you, Palisa. As you said there in your introduction that not a lot has been said, but I can tell you that yesterday the Premier of KwaZulu-Natal, Simphiwe, when he addressed the State of the Province address, he did announce that the province has identified 4 hospitals to be able to actually treat any possible outbreak of the coronavirus. Those hospitals are Addington, which is in Durban, and Manguzi, and as well as in the northern part of the province. But the key question, Palisa, is the issue of the capability of those hospitals that have been identified to deal with this outbreak. Because if you speak to a number of South Africans who use these public hospitals, they will tell you that they don't have pleasant experience when attending those public hospitals. Here where we are, we're expecting the MEC for Health in KwaZulu-Natal, Nomagugu Simelane Zulu, to actually give us an update as to what are these measures that have been put in place that to actually address this, as it was announced yesterday by the Premier of KwaZulu-Natal. Because you'd recall also, Palisa, that the issue has been around bringing back those South Africans who are in China, who obviously wanted to return home since the outbreak of the virus. But in terms of dealing with the actual now confirmed cases, we are yet to hear if the province of KwaZulu-Natal will be able to deal with this outbreak now that it has been confirmed. Palisa?
Yeah, and I suppose, Simphiwe, we don't know as yet in which part of KwaZulu-Natal is this man, and that's what we're waiting to hear, I suppose, from the MEC once he comes out of that SOPA debate.
Certainly, but the question about where he comes from, the minister did allude in his speech in Parliament that they did not disclose any further details about his whereabouts and also where he comes from in the province. But what we do know is that he is from KwaZulu-Natal. He's a 30-year-old man who had traveled to Italy together with a group of 10 other South Africans who returned early in March when the virus was actually dictated that he does rather have this virus on the 2nd of March. The question now that many South Africans will be asking from the officials and authorities in the province and in the country is, what are these measures that the country has been talking about, that the officials have been talking about, to say that they've been put in place to ensure the safety of ordinary South Africans? Because I can tell you now that there's this confirmation. People are probably panicking wherever they are, asking if South Africa or the health department in the country will be able to deal with the outbreak of this nature.
All right. So, as you say that Premier Zikalala, during his State of the Province address, identified or mentioned the 4 hospitals in the province that have been identified to deal with a coronavirus. What's your knowledge on these 4 hospitals? What do you know about them? And perhaps when one looks at the issue of capacity, so to say, and the capability?
Capacity is obviously a big issue, Palisa, because when you look at a hospital such as Addington, if you speak to people who attend these public hospitals, Palisa, they will tell you that in some instances these hospitals run out of beds, they run out of just basic medication. So you ask yourself, if the province of KwaZulu-Natal says that they've identified these hospitals to deal with this outbreak, then you ask yourself that the obvious question is, what have they done to those hospitals to ensure that should there be a possible case of this coronavirus, then the hospitals are actually in a better position to handle the case. But the MEC for Health in KwaZulu-Natal, Nomagugu Simelane Zulu, will be speaking to us briefly, because we understand at the moment that she's being briefed by the national team from the Department of Health. So she will give a comprehensive response as to what are some of the tangible interventions that they are going to be making to ensure that this virus, the spread of the virus, is contained. Palisa?
And Simphiwe, just finally, I don't know if you've been able to speak to the ordinary people of KwaZulu-Natal, because I know that you've been attending the debate of the State of the Province address, but one believes that this, in a way, sort of creates that sense of panic once coronavirus is mentioned.
Certainly, Palisa, ever since the outbreak was reported, the suspected cases were reported in the country in particular. Many South Africans were expressing they are actually panic. They're saying that they are not sure whether the country is in a position to actually deal with this epidemic, seeing that the country such as China, with a big economy, is unable at the moment to actually quell this or to deal with the outbreak. So the questions, the million-dollar question is, will South Africa be in a position to deal with this outbreak now that it has been confirmed? Palisa?
All right, Simphiwe, we'll leave it at that. We'll certainly be coming back to you as soon as the MEC is available. SABC News reporter there, Simphiwe Makhanya, reporting live from Pietermaritzburg. So as soon as the MEC is done with her meeting, we'll certainly be crossing back to Simphiwe to speak to the MEC regarding this matter.